Okay, sir, are you on any medications? I'm on prednisone for inflammation. I think you mean prednisone. Whatever. Okay, anything else? Albert Roll helps me with my breathing. Sir, Albert Roll sounds like a man at a bakery. Whoever he is, he fixes my asthma. It's albuterol. Albert Roll. Anything else? Yeah, Zolock. Zolock? Like a lock on a zoo. What do you take it for? To keep the animal in. Zoloft. Anything else? Viagra. Hey, you said that perfectly. Oh yeah, I made sure to learn that one. Of course you did. Hey, Austin, patient in room 4 is an amputee and I need help moving his fake leg. It's crazy heavy.
No problem, boss.
Great, but don't get too close to this guy. He really likes male nurses. Well, Austin, didn't peg you for the strong type.
Thank you, but it's more about the grip than anything.
Oh, I could tell you have a nice, strong grip.
Well, thank God I do. What's this thing made of anyway?
Steel. Welded it myself.
Whoa, no way. That's so cool.
Oh yeah? Why? You like people who work with their hands?
Well, I used to knit with my grandma, but it's nothing compared to a giant heavy leg.
Well, I'm a giant heavy leg kind of guy.
Wait, what does that mean?
Well, my first leg is pretty heavy. My second leg is even heavier. But my third leg? All right, that's enough.
I don't get it. Oh!
The Q word. Medical workers in the ER are very superstitious and are most triggered by the Q word. If you come into the ER and it's a little eerie because everyone is calmly sitting and we have no patients, don't you dare comment on it. Specifically, don't say the Q word. Ask anyone in the ER and they will tell you it's a proven fact that saying the Q word is a green light for anarchy and disorder to descend upon the ER and wreak havoc. It's gonna get busy and it's gonna be your fault. Don't believe me? Get this. Someone once said the Q word and I saw 5 ambulances, 10 patients, and a tsunami show up into the ER.
That's right.
Anyone so much as utters that word and our waiting room fills up so fast, you'd think we were giving away free Vicodin out there. So the next time you're in the ER and you look around and you think it's a little, keep it to yourself. Lock it away inside, because if you say it out loud and this place goes sideways, we are never gonna forgive you. Hey, it seems pretty quiet here today. Son of a...
Okay, ma'am, is there anything else I can get you?
Do you have any tea?
Of course, what temp?
Extra hot, please. Sizzling.
So yesterday, one of the doctors got caught making out with one of the travel nurses in the pediatric supply room. And they're both married.
Oh my God.
I know.
Hey, do you have a pen I can borrow? I can't find mine. We can't find any either. They all disappeared. In the whole hospital? Well, not the whole hospital. What, you think I stole your pens? I'm just saying, it's a bit weird. You're the only one left on this floor with pens. Where are the pens, doctor? Huh?
What are you hiding?
Well, come on, this is crazy. Oh, tell you what, I need help changing a patient in room 4. Do that and I'll buy everyone all the pens they could ever need. But be careful. She's a bit strange. Hi, Miss Johnson. I'm here to change you real quick.
Change me? You mean like down there?
Yep, just normal changing. Should only take a minute.
Oh, no thank you.
Since you're unable to go to the bathroom yourself, I have to.
I don't need it!
Miss Johnson, please, I can smell the room. It'll only take a minute.
Okay, fine.
Yeah. Mrs. Johnson!
I can explain!
What? You're the one who stole all the pens?
I have a problem.
Why would you hide them in your vagina?
Because I didn't think anybody would look in there.
Yeah. Is this it, or is there more somewhere?
Well, you didn't happen to see a red pen down there, did you?
No, but I don't know how I would have missed it.
Well, here's the thing. I may be a klepto, but I'm very organized.
Oh, no, don't tell me it's...
I'll flip around.
Oh.
Your condom catheter's on, Ron. You could pee now.
Can you turn on the suction for it?
Oh, we don't need to turn on the suction. You could just pee.
It would really help if you turned it on. The last nurse did it for me.
Well, okay. Ron, are you okay?
Oh.
Oh my God! Ron!
I would like to remind everyone at this hospital that we do not hook up any patient condom catheters to the suction. That concludes today's huddle. I still can't believe you did that.
Well, I figured it wouldn't hurt him.
Oh, you did quite the opposite of hurting him.
Oh, shut up.
Oh, quick, I need help. As you can see, I've been in a horrible ice pick accident and I need to see a doctor right away.
Oh my God. Okay, 1 second.
Okay, great, thanks.
Is there anything else we should know?
Yes, I don't feel safe and I desperately need a room near a police officer, if possible.
What?
I also have a phobia of heights, so I'll need a room somewhere on the first 3 floors, but not the third, and preferably not the first floor either.
So you want a room near a cop on the 2nd floor?
Yes, if that's possible, or whatever.
Sir, are you really here for an ice pick accident?
Okay, fine, you caught me. My wife's upstairs in police custody, and they won't let me see her.
What?
All she did was rob a little gas station, and now they're treating her like Pablo Escobar. It's not fair.
So you faked getting attacked with an ice pick so you could see your wife?
Yeah, romantic, right?
No, sir! What were you gonna do when we found out this injury was fake?
Oh, this injury is real.
That's not a prosthetic?
Oh no, I really stabbed myself with an ice pick, and I think I hit bone.
Oh my god! Doctor!
Tell him about the 2nd floor.
No!
Frank, this is your 5th UTI. I don't understand why it keeps happening. How many times a day do you straight cath yourself? About 4 to 6 times a day. Do you wash your hands before you do it? Of course. Okay, show me how you do it. No problem. Do you want some lube first? Oh no, I have my own technique. What technique? There, it's in. I think I know how we're gonna stop your UTIs.
Really? How?
Lube!
Tips from the ER. Code PINK. If you've already been in the ER for the last 5 hours getting your finger sewn up because you had a little accident with a kitchen knife, be prepared to be here a little longer. If there's a code PINK, we're locking this place down. No one's leaving because there's a baby missing. That's right, we couldn't get the slime off of it fast enough before somebody decided your baby was too cute not to take home. Code PINK means someone stole a baby or the nurse accidentally gave it to the wrong mother. Either way, we can't find them and we're blaming everybody until the little poop monster shows back up. And we will find it. The second a code pink is called, I expect every staff member in this building to drop whatever they're doing. I don't care if you're mid-stitch, mid-itch, mid-shit. A code pink should have your full attention. You can bet I'll be in the hallways looking at you, looking at me, looking for a baby. If you happen to see someone holding a bundle of blankets with an umbilical cord hanging out of it, notify your nearest hospital personnel. If you happen to be holding a baby, you might get tackled. Even if that baby is yours, we can't take any chances. But this is my baby. I have the birth certificate right here.
Ma'am, drop the baby!
No! Code pink!
I'm so sorry for the wait, ma'am. How can I help you?
I have been waiting here for over 3 hours. Does anyone even work here?
Yes, we're just a little busy with—
Hey, you said you'd be back with water for my mom.
I'm so sorry, sir. I'll be right there.
What about me?
But not before you, ma'am. Hello?
Hey, labs came back for your patient in room 5. It's not good.
Oh, shoot. Okay, I'll be right there.
Where is the doctor? He's running a little behind right now.
Hey, I need to pee!
No, Mr. Rogers, I need you to stay in bed. I'd like to speak to your manager, please.
No, please. I'm here. I promise. No more interruptions. What brought you into the ER today, ma'am?
I have a rash from this new lotion I've been using. It's itchy.
That's it?
Yes?
Why didn't you just go to your primary care doctor?
Because their next appointment is 6 weeks out.
And you're complaining about waiting 3 hours?
Hey, I got a really bad headache. Can you help me?
Oh my God, sir, are you okay?
Hey, you said no more interruption.
This man has a knife in his head.
I was here first.
You just need some over-the-counter hydrocortisone cream. You don't even need to be here.
Well, how was I supposed to know that?
There's gotta be a better way.
Your vitals all look good. The doctor will be in soon to examine your rash.
Do you know what it is yet? HIV? HPV? Ebola?
No, sir, I don't think it's any of those things.
Oh God, it feels like my skin is falling apart.
Please, sir, it's just a minor rash.
Don't you have anything to help me? My skin is peeling. I'm gonna be nothing but bones by the time the doctor gets here.
All I have is this diaper rash cream. Put some on your skin, it'll soothe your rash until the doctor gets here, okay?
Hello, Mr. Richards. I see here you have a minor— Ah! Oh, thank God you're here. The way that rash was looking, I was starting to feel like a real monster. What the— Oh, by the way, your Kentucky jelly tastes really bland. What is Kentucky jelly? It's that tube of jelly over there on that machine. That's KY jelly. Whatever it is, tastes terrible. Oh. Got here as fast as I could. Where's the emergency?
The baby's crying again.
Okay. And what would you like me to do about that? Make it stop? The sound's getting pretty annoying. Okay, so that's a baby? Crying is kind of his whole thing.
Oh, well, his thing is giving me a migraine.
Yeah, can't you work your magic or, whatever?
That's what you do, right?
Not exactly.
Thanks, you're a lifesaver.
Also, diaper's full. Of course it is. Anything else I can do for you guys while I'm here? Maybe file your taxes?
Oh no, we did that already. We're responsible.
Right. Just not with your baby. Oh no, we're great with kids. Just You know, not this part.
You mean the parenting part?
Exactly. Ugh. It's the crying, the feeding, the holding,
The sleeping, the waking up, the diaper.
the whining, the burping, the spitting.
So, the baby.
Pretty much.
But he'll grow out of it. At least that's what happened to our other ones.
I'm sorry, your other ones?
But you thought this was our first kid? No, this one's our third.
We're pretty much pros at this point.
Uh-huh. Where exactly are your other 2 kids right now?
Oh, they're right over. Oh, they're just here somewhere.
Fantastic. 2 missing kids, 1 dirty diaper.
Hey, while you're holding him, can you make sure he's eaten? I think he might be hungry.
Huh, yeah, sure. Why don't I just breastfeed him for you while I'm here?
That'd be great. You're the best.
Blink twice if you want me to call Child Protective Services.
Your wife is doing so well today, Gary. Her vitals are stable, no skin breakdown. I think this is the most peaceful I've ever seen her.
Oh, I think I know why.
Really? Why do you think? What is that?
That's mine.
Your what?
My hair.
Hair from where?
My belly.
Why is it on the rail?
When Maisie and I used to lay on the couch at night, she would always put her hand on my belly. I think it made her feel safe and at home.
So you
Brought a piece of home here, and it's helping. Isn't it, Maisie?
Sir, I don't think it is.
You said her vitals were stable today.
Yes, but
That means she could feel me. Gary's here, honey. Can you please make sure to lift her hand every few hours so she could touch my hair?
oh, sir, I'm not touching that. You know, most families just bring in a picture, some flowers, or a favorite scent.
But this is a good idea too, right?
Well, you can't argue with the results. She is stable.
No one told me that eating 6 Tide Pods would give me uncontrollable diarrhea.
Sir, we're gonna have to keep you at the hospital.
I've already been here for 9 hours. I know, but
Ben, can I speak to you?
okay, be right there. Hey, I still need help. Ben, why did you discharge Mr. Isaac in room 3 without ordering a CT scan?
Because he didn't need a CT scan.
He came in for a broken bone.
And the x-ray confirmed that.
You can never be too sure. An extra CT scan would have been more definite.
Did you see the x-ray?
We successfully reduced it back into place and he's following up with ortho. Yes, but then we can't opt for higher reimbursements.
So just to be clear, this month you've denied my pay bump approval, you've declined my request for time off, and now you want me to opt for a line of care for my patients that will maximize profits?
We like to say align proper care with the hospital's vision to prioritize profits. I mean patients.
There are not enough beds or staff here to keep patients for unnecessary tests. I am doing the best I can with the limited resources you have provided me with.
Ben, you're needed in room 263.
I'm needed everywhere because there's not enough of me.
This is what you signed up for.
No, I didn't sign up for this. I can't take this anymore. I'm done. I gotta go somewhere. I need to laugh.
Oh my god! You have to go to the Stephen Ho Not Your Hero comedy tour!
The what?
According to your symptoms, upset stomach, anxiety, depression, high blood pressure, oily skin,
Okay, that's enough symptoms.
you may need a dose of comedy. Or at least, relatability. Ooh, sounds exciting. Am I invited?
No.
Ma'am, you are having abdominal pain because you are pregnant. There is no way! I can't be pregnant! We tested your urine sample. You're pregnant. I'm telling you, that's not possible! Are you sexually active?
What? No, not exactly.
It's either a yes or a no. Are you sexually active?
No, I wouldn't say active. I kinda just lay there.
So that's a yes.
Can't you just run the test again?
No!
Tips from the ER. Your congested nose. Oh! That's a whole lot of loogie. Look at his poor face. Guy looks like he just accidentally walked in on his parents getting it on. Irrigation devices are great for reducing congestion, even in kids. Only use distilled or sterile water. Non-sterile solutions like tap water contain microbes that can cause infection. If you have a baby, you could use a blanket to wrap them up like a burrito so they don't flail around. Get ready, here it comes. This technique of wrapping up your baby is called swaddling. It's been so long since I've been held like this. We use this technique all the time in the ER if baby needs an IV or they need stitches around their head. One more time, just because it's fun. Ooh, so satisfying.
Hi, sir. My name is Austin. What brought you into the ER today?
I got this cut on my leg. It's not getting any better. Can you pull your pants up so I can see it? Yeah. Oh wow, it's really infected. How long has it been like this? Like 4 or 5 days now. You're gonna need to change into a hospital gown. I'll help you take your shoes off. No! Sir, is everything okay? I'm not taking my shoes off. But we have to take your shoes off. And your socks. And your pants. I'm not taking my fucking shoes off. Sir, we ask everyone to take their clothes off and change into a gown. It's much easier for us to— I said I'm not taking my fucking shoes off! Yo, Austin, is everything okay in here? Ooh, wow, that leg is infected. He won't let me take his shoes off. Sir, that cut is way too close to your foot. You absolutely need to take your shoes off. I'm fucking leaving. No, sir, please, you can't leave. This is dangerous. You might need surgery. Dude, what is the big deal? Just take your shoes off. Whatever it is, I promise we've seen it all. Fine, take the shoes off. Oh. I don't want to talk about it. Did someone paint your toenails red? I said I don't want to talk about it. They're really pretty. Thank you. Okay, I lied. I had never seen anything like this. Good day.
Tips from the ER with Bill Gates. What is the most common emergency room visit that requires immediate surgery?
Appendicitis, I guess.
Correct. Appendicitis is when your appendix becomes inflamed or swollen and you absolutely need surgery. 1 in 13 people will get an appendicitis in their lifetime. Very dangerous because if it becomes too inflamed or swollen, it will burst and its contents will leak into your abdominal cavity. Its contents include poop, bacteria, fluid, and it can cause a really bad infection in your body. An appendix is a pretty useless part of the human body, so it's not the worst thing in the world to lose one. The second most useless human body part, male nipples.
Excuse me, I've pressed this button 3 times. Do you people even work here?
We do, we just don't teleport.
I asked for a blanket 20 minutes ago.
Correct. And in that 20 minutes, we have saved a life, started 2 IVs, and convinced a grown man to stop eating his own hair.
Well, that's not my problem. I am paying you to get me a blanket when I pressed a button to get me a blanket.
Right, okay. Let's clarify something. Are you bleeding?
No.
Are you having a heart attack?
I mean, according to your vitals, you are stable. You are not waiting because we don't care. You are waiting because you are currently alive and stable. Hey, I don't like your tone.
I can have an even worse tone if you like, because this is not customer service. This is healthcare. This is not a Burger King. You will not be having it your way. Here's your blanket. You see how you got it even after speaking to me like that? I want to speak to your manager. Go ahead, call them. The only person managing me is Jesus himself. Here's a life lesson. If you're scared, just say that. If you're in pain, say that. But if you're rude, you're gonna make this day a whole lot longer for yourself. All you need to say now, thank you. Thank you for what?
Thank you for the blanket.
We advocate best for our patients who remember we're human. And for the record, next time you hit that call light, say please. Makes it connect faster.
Welcome to the ER. How can I help you?
I swallowed an ice cube yesterday.
Okay. Did it scratch your throat?
No, but I'm scared. It hasn't come out yet.
What do you mean it hasn't come out yet?
I haven't pooped it out yet.
You're not supposed to.
But it's been over 24 hours. Shouldn't I have pooped it out by now?
No.
Medical Mysteries with Bill Gates. Is this good advice or bad advice? When you have sudden onset of stomach pain, eating or drinking something will make it better.
Oh, that's probably bad advice.
Bad advice. Correct. It is bad advice because if your stomach is in pain, eating or drinking something will oftentimes irritate it even more. So you want to give it a rest. That's the first thing that we tell you when you come to the ER too. When you come to the ER, if you have anything that's wrong with you, we tell you not to eat or drink anything until we find out exactly why in case you need emergency surgery. So your stomach has to be empty because it'll complicate the surgery. I've had surgeons oftentimes will delay surgery if you've had anything in your stomach within the last 24 hours, right?
Because you could, I guess, get sick and that would be hard to breathe then?
Yes. So if you're on anesthesia, your muscles aren't working, right? Any contents from your stomach that leaks out of that tube that goes into your stomach could go into your lungs, causing you to aspirate and choke and die.
Excuse me, my girlfriend has an emergency and she needs to be looked at right away. What's going on, sir? Okay, he's being dramatic. It's not really an emergency.
Oh, it's an emergency.
Okay, just tell me a little bit more about what happened. Oh my god, what's that smell?
That's why we're here.
I read online that yogurt is supposed to be good for maintaining proper normal flora in your gut and your vagina. Oh yes, I've heard the same thing. It's great for maintaining good bacteria within your body and can even help keep a healthy pH balance. See, I told you yogurt's good for you.
Yeah, when you eat it.
I'm sorry, what's going on?
She wasn't eating it.
If you weren't eating it, then what were you doing with it? I thought it was supposed to go in my vagina. You know, where the flora is? Oh. How long have you been putting yogurt in your vagina? Several days. Oh my god, is that what I've been smelling? Yeah. Oh dear. And when did you realize this was a problem? Earlier today, when my boyfriend and I were having sex? Oh. What happened during... I didn't even notice there was a problem. We were only about 30 seconds in when my boyfriend put my pants on and said we had to go to the doctor right away.
You think it smells bad? Just imagine the taste.
Oh my god!
Welcome to the ER. How can I help you?
I'm having a stomach ache.
When did it start?
Like an hour ago, after I swallowed a fork.
You swallowed a fork?
Yeah,
Why did you swallow a fork?
I wanted to see if I could do it.
What? Have you tried it before?
No.
You're sure you swallowed a fork?
Mm-hmm.
Okay, well, we're gonna need an x-ray just to be safe. Are you able to walk? Can you follow me?
Yeah. There is no way he swallowed an entire fork. You never know. I once had a pica patient who swallowed rocks and chunks of concrete. They can't help it.
Have you called psych yet, Ben? Not yet. I want to confirm the fork on the x-ray first. Oh, here it is.
Oh my god. What is all of that?
Sir, we got your x-rays back.
Do you see the fork?
Yes, we see the fork. We also see half a dozen coins, a toy car, and another object I can't even make out.
Oh, it's part of a TV remote. I knew it!
Rich! Sorry! Sir, this is very dangerous. You're gonna need surgery to remove these objects.
Oh, but those aren't bothering me. It's just the fork.
Sir, your pain is being caused by all the objects in your stomach.
No, those have been there for years. It only happened after the fork.
What do you mean, years?
I'm telling you, it's only the fork that's bothering me.
Alright, look. We can figure this out, okay? I'm gonna go get you some pain meds, and I'm gonna have some people come down to talk to you. Just don't move in the meantime. Okay?
Fine, but nothing except the fork is coming out.
That will be between you and the surgeon.
I'm an OB/GYN. When I first started training, I was learning to do cervical exams to check patients in labor. I am examining this patient and I feel something that even I know isn't quite right. It feels hard and kind of crinkly. I take this thing out. It is black, desiccated, and just coated in copious amounts of discharge. I'm turning it over, trying to figure out what I'm looking at. I eventually see a yellow smiley face. It's the remains of a Walmart plastic bag. I am surprised the face was still smiling. I tell the lady, "Ma'am, you had a plastic bag in your vagina." She goes, "How did that get in there?" I say, "You tell me." She swore she didn't know. All of us on L&D decided this was likely the condom that was used to prevent the pregnancy that she was currently delivering. Anyway, the moral of the story is, don't use plastic bags as contraception, please. Most people just keep their Walmart bags under the sink. You do you, boo. What city was this story come from? My guess, Arkansas or Alabama.
It's from Alabama.
It's from Alabama! Imagine what the dirty talk in bed sounded like. Do you like paper or plastic? I work in OB/ER. We were told a patient was coming in who had been hit by a chicken. What actually happened was that she was 26 weeks pregnant, worked in a grocery store, and a disgruntled customer flung a frozen chicken across the counter and hit her in the belly. She and the baby were both fine. She went full term after the chicken incident. The baby wanted to come out immediately and find out who had the audacity to throw the chicken at its mom.
I once had a patient that wanted to keep her pain pump so badly that she locked herself in the bathroom and wrapped herself onto her IV pole. Wow. If you don't know what a pain pump is, it's essentially a pump that we hook up to an IV pole. All you have to do is press a button and the pain medication goes directly into your IV and into your body. It's usually given to patients who are in severe pain who need it every few hours. The good thing is the pump only allows you to press the button every few hours or only when you're allowed to have it again. So you can't just keep pressing it. But yeah, she really wanted to keep her pain pump. Patients are addicted to pain medication.
If you hear your name, please follow me. Tough Kane. Tough Kane, are you here? I think you mean Tony. Tony? Yeah, Tony. Don't worry about it, man. No one gets it right the first time. I wonder why. X10? Is there an X10 here? It's Kristen. How is that Kristen? Seriously? Christmas, also known as Xmas? X is short for Chris. Chris. 10. Present. Leah. Is there a Leah here? Oh, that's probably me. You're Leah? It's Ladasha. Of course it is. Everyone follow me.
When my dad was an ER/trauma nurse out of college in the 90s, he found a sandwich in the fat folds of a patient, and they said, "Oh, that's where my sandwich went." Let's hope to God this guy never loses his dog. Sir, there's a reason they're called cold cuts. You do not need to keep them warm. This happens all the time, by the way. We hear stories about this all the time. Really large patients will lose things under the folds of their skin. We once found a dead cat. The cat wasn't very nice, is what I'm being told.
I decided to watch myself give birth when I had my third kid. Okay. You can watch yourself give birth. They will give you a mirror so you could see what's going on as you are giving birth to your baby. I already had 2 other babies, so I thought I knew what to expect. But once I saw the mangled mess down there,
I'm talking downtown.
I was shocked and didn't know what to say. So, as I saw my son's head emerge, I looked at my husband and said, "Look, there's the sperm you left in there." Definitely a memorable birth. LOL. Is it considered a dad joke if the wife says it?
Roger Coast, are you here? Excuse me, sir, do you remember me? Yes. You fell off a bike yesterday. And you guys said there was a small fracture in my arm. Yes, I remember. Is everything okay? You guys gave me my x-rays yesterday and they were black and white. So? I paid good money to be at this hospital and I get black and white x-rays? Sir, all x-rays are black and white. Really? Yes. Oh. Okay then. Thanks. Roger Coast, are you here? Welcome to the ER, sir. How can I help you? I think my daughter swallowed a penny. Tata. Doesn't look like she's doing too bad. Can I get her name and date of birth? Oh. Shoot. You don't know your daughter's name and date of birth? You know, my wife is usually here with me. Oh, let me check my tattoos. Your what? Tata. Sophia Sorrento, July 6th, 2022. Got it.
I don't know who trained you, but that's not how I want it done. You flushed before the draw? Why would you do that? I thought, don't think, just follow orders. Now we have to redraw everything because you couldn't listen. This is basic. Basic! If you can't handle that, maybe you shouldn't be a
Okay, that's enough.
I'm speaking to her.
You're speaking at her and you can stop now. You're upset about a saline flash.
It compromises the labs.
No, it ensures the line is patent and working before we draw. And we need a working line to draw blood, right?
Yes, but
And we waste the first few mLs so it doesn't affect the results. We have that process perfected so it seems like it didn't happen at all. Do you waste before you draw labs?
well, no. But
So you're telling me that the saline and possibly medications that are sitting in that unflushed line mix with that first tube of blood you draw?
maybe, but
And that mixture can ultimately alter labs way worse than what you were just yelling at my new nurse for?
well, that's not how I was taught in med school.
So you were taught a bad practice in med school and somehow that makes it okay? Tell me, how many patients did you wrongfully treat based on diluted results?
Just next time, make sure you follow the doctor's orders.
And if those orders are wrong?
Question them.
That's what I thought. Make sure your argument makes sense before you get all bent out of shape. Have a good day, doctor. Good work. You asked, you listened, you did it right. That's what a good nurse does. First rule of this job, if it doesn't make sense, question it. Second rule, no one gets to learn by being humiliated. Unless you bring those weird jelly donuts from the corner store. Those are disgusting. But besides that, you're safe here. Now drink this before it gets cold, and file a complaint about that doctor. He will not be raising his voice like that again. That part's in order. Alright, what do we got? 35-year-old female, chief complaint of abdominal pain, says she thinks she's pooping, but she can't get it out. Took 4 of us to get her here. Why? She's 650 pounds. Oh, get it out of me! It hurts! Ah! Who called it in? Her boyfriend. He's on his way. Help! Please, I can't shit! Are your guys still here? Can they come help lift her legs so I can see what's going on? Fellas, get in here. We gotta spread a woman's legs. Laura, I'm here, baby! That would be the boyfriend. Great, he can come help too. Everyone, grab a leg. I see something. What is that? Is that a baby? She's having a baby? We're having a baby? I'm having a baby? How did you manage to do that? Love. Help! All this time we thought it was shit, but it's a baby. If only every shit could be a baby. Oh, kiss me, Bert. I love you, Laura. Will somebody please call labor and delivery? Hi, sir. I'm here to draw some blood.
How long is this gonna take? It's been 2 hours.
I'm sorry about the wait, sir, but we're just trying to make sure you're okay before we discharge you.
I can't stay here all day.
With all due respect, sir, what could possibly be more important than your health?
I have a dog waiting for me in the car.
Wait, really? It's 90 degrees out.
That's right. Hurry this up.
This sounds so dangerous. I'll be right back.
Wait, come back. Finish my blood set.
What the hell? I checked the parking lot and I couldn't find any dog waiting in the car.
I parked on the street.
Oh, okay, what type of car do you drive?
It's a blue Chevy.
I didn't see any blue Chevys parked on the street. What type of dog?
Golden Retriever.
Oh, that poor dog. I asked around and no one's seen a dog. I thought I saw a dog, but it was a mirage. Oh, it's so hot.
Ha! Now you know the frustration I've been dealing with. I don't even have a dog.
You made all that up?
Yup.
You know, for the record, I was trying to get you out as quickly as possible.
Was? Where are you going?
Shift's over. Your night shift's problem now.
Come back here.
If you need me, I'll be in your blue Chevy.
I actually do have a blue Chevy.
বস আপনি কিন্তু আবার রাগ করেন না বুড়ি বেড়ি বয়স হইছে মা থাকো তুমি তোমার লগে পরে কথা কইতেছি হ্যাঁ সাইকেলের চেনটা এখানে এসেই পড়ছে
ভাই ঠিক হয়ে গেছে
কিরা তো জলদি ঠিক হয়ে
তিন জানে জামশেদ চাচা খোয়ারে ধরে নিয়ে গেছে
কি কইলি জামশেদ চাচার খোয়ারে নিয়ে গেছে মানে তাও ফকিন্নির পোলা 100 টাকা কম দিস বুঝছস তোমার নাম
মৌ
কি নাম
প্রিয়া
প্রিয়া
জানালায় জোড়া চোখ পড়ে না
একদম পরীর মতো দেখ
কি কস সত্যি নাম কি বাড়ি কই
আচ্ছা আমি যাইতেছি
প্রিয়া
পেন্সিল ভাষা পেল কি কবিতার
ওই জামতলায় আপনার সাথে আমার মুখোমুখি সব কথা হবে, ঠিক আছে? গেলাম।
আপনাদের খোলা চুলে খুব সুন্দর লাগে, একদম কাজলের মতো। আর সেই জন্য সাইকেলের চেনটা এখানে এসেই পড়ছে।
ভাই
কিছু হয় নাই, হবেও না।
হবে না তবে না কি শুরু করছে বলো তো?
तुम नहीं समझोगे प्रिया।
আপনার হাতটা একটু ধরবো?
আমার হাত?
কবিতার পাতা ছুঁয়ে মন জনাকি।
আর তোমার?
হ্যাঁ বিলেতি নায়ক হইব। এই
মতো পুরো
চকটাও নষ্ট হয়ে গেছে। ঘরে চকটা নষ্ট হয়ে গেছে। চল
শুনো, তোমার এই পোলা গ্যারামের 8-10টা বাদাইম্মা পোলার মতো না। আমার কিন্তু গ্যারামে শুনছি, জিনিসটা আমলে রাখলাম, কইলেই তো রয়ে যায় না।
আচ্ছা এখন ওই
ভুইকা গেছে।
কি আজব না বিষয়টা?
না না, আজব হইব কেন? আপনি আমার বস।
ভাই তুমি আজকে মনের কথাটা কয়ে
সন্ধে আকাশে খুঁজে আজ
না মানে এই হ্যাঁ ওই যে সিনেমা, শাহরুখ খানের সিনেমা দেখতে দেখতে বড় হইছি না।
ভয় পাচ্ছেন কেন? সামনে আসেন। আরে আরো কাছে আসেন।
খুঁজে আজ জানালায় জোড়া চোখ।
আগের দায়িত্ব ছিল না, তাই হারানোর ভয়ও ছিল না। আর এখন দায়িত্ব আছে, তুই ছাড়া কিন্তু আমার কেউ নাই। হ্যাঁ,
আমি জায়গায় থাকতে পারবো না, তুইও ঘুমাই পড়।
আচ্ছা আমি যাইতেছি।
কি সমস্যা? বাচ্চা আজকে তোমার কি হয়েছে বলো তো?
যখন আমি খোলা চুলে দেখি এই দিলে तुम नहीं समझोगी प्रिया।